Hello and welcome everyone to the first Quality Rights webinar. And thank you all for joining us today. And so this webinar is organized by the Division of Mental Health, Ministry of Health, Kenya. And it's based on themes related to mental health, human rights, and disability in order to reinforce the implementation of the WHO Quality Rights Initiative in Kenya during the May Mental Health Month. So this aims to promote the rights of persons with psychosocial, intellectual, and cognitive disabilities during this time of COVID-19 pandemic, as well as promote mental health well-being. So the format of this webinar we'll have presentations from our panelists, and then will be followed by our question and answer session. And you could use the chat and Q&A sections below for all the attendees to ask any questions you may have. During the session, you can also use, in case you'll be tweeting, you can use the hashtag #QualityRights in COVID. And we could now proceed to start, and we'll start off by our first panelist, who is Catalina Devandas. So she's a first UN Special Rapporteur on the rights of persons with disabilities. She's a lawyer by training, a human rights defender, and has worked extensively on disability issues at the national, regional, and international levels. During her mandate, she has published different thematic reports on the rights of persons with disabilities, including on the right to health, the right to legal capacity, and the right to liberty and security of person. So welcome, Catalina.
Well, thank you very much, and thanks for the opportunity to discuss in this very important issue. I believe that reflecting on how the pandemic it's affecting the enjoyment of rights of persons with psychosocial disabilities, intellectual, cognitive, as you mentioned, and specifically what are the implications when it comes to accessing services, health services or social services is quite important. The pandemic has caught us unprepared to address in general the needs of the whole population, but specifically the needs of persons with disabilities. One of the things that we are noticing around the world is that persons with disabilities have been an afterthought in general in the responses to this pandemic. And when it comes to persons with psychosocial and intellectual disabilities, that has been extraordinary because the impact is disproportionate in persons with disabilities in general, but for these groups, it has particular impacts that have been overlooked and then are, of course, negatively impacting in their lives and their enjoyment of their rights. But first of all, please, I know that we have been discussing this around the world, but it is important to remember that persons with psychosocial and intellectual disabilities are a high-risk group when it comes to the COVID-19. First, because they face a lot of barriers to accessing health information, to implementing hygiene measures and social distancing, for instance. There is an inherent risk in psychiatric facilities and in institutions in where sometimes these persons, and very often these persons reside. They are overcrowded, unsanitary, the conditions and the restraints, for instance, the seclusion that has been used now as an excuse also to limit the social contact. We have restricted access to water and sanitation facilities. And also it's important that these populations are overrepresented among those that are homeless or that are in prison. So these are all factors that increase the risk for this group. Also, they have higher risks, or they are at greater risk of developing more severe symptoms and of dying. This is important as well. We have stressing that the high number of fatalities of this group. First, because there are underlying health conditions, and this is not only due to comorbidity, but in many cases due to the medication that these persons need to or are using. Then they have weakened immune systems, that it's also related to poverty and in some cases institutionalization. We have systemic discrimination against persons with psychosocial disabilities and intellectual disabilities, and this has been very clear, for instance, in the whole discussions about how do we allocate care resources and what is now it is known as the triage protocols, and how it has been decided that persons with intellectual disabilities, for instance, might not be recipients of a ventilator if need be, or to access ambulance or even emergency healthcare units, right? So these are important challenges that are, making us or compel us to rethink how we need to address the mental health services and the mental health responses in the COVID-19 crisis. I want to stress the issue of the fatalities again, because when we have, from the places that we have data and data has been collected, the percentages of COVID-19 related deaths that have occurred in institutions, home care institutions, ranges from 19%, so almost 20% of the fatalities, to 62%. So it's a huge number, a huge percentage of the fatalities that are happening in these places, and we're seeing every day more data and more information and more media coverage coming saying what is the situation in these hotspots. We have the rates of infections and deaths in psychiatric services, to be more specific, keeps rising, and then we have reports from many countries in the world: South Korea, the UK, US, Romania, Poland, Uruguay, Guatemala, Peru, Ghana. So it's all around the world, and in some cases the totality of the residents, or almost the totality of the residents, have been infected, and and many of them have died. Then of course there are more risks when accessing mental health and psychosocial support. And this relates to also the disruption of the support that persons with disabilities need in their daily lives. Because of the emergency measures, because of the isolation, some of these, and because of also the pressure on the healthcare systems, which have focused on attending the pandemic and then have less resources to support the services that are needed or that some of these persons use. So we have also disturbances on the transportation system, which also reduces the chances of persons to get to their services. In some cases, the closure of the services because of the lack of staff, and in many cases, understaffing across the board when it comes to all these services. So in addition to that, what we have seen is, because of all these structural reasons, and also because in some cases it's easier to manage, what we are seeing, and it's very worrisome, is that some countries have relaxed their human rights standards and protections during the pandemic. And this, I think it's very important to stress. This should not be an opportunity to limit the enjoyment of rights of persons with disabilities, or to reduce guarantees for involuntary commitment, for instance, right? It might be easier, or for involuntary treatment, right? So it might be easy to keep people in seclusion and restraints, or we increase seclusion and restraints because it is argued that it's in favor of physical distancing, etc. But it results on actually less guarantees, or ignoring the guarantees that have been established to protect persons with psychosocial disabilities from these types of abuse. Also, many countries are rushing to see how we use the digital technology to provide the services that cannot be provided during this crisis. And I want to be, I want to call for a little bit of a little bit of attention on this, because this is not a silver lining, right? We have to think about how this is going to impact on the privacy of mental health data. How is it going to impact in the procedure, in the protocols to obtain and express informed consent, right? And if we are going to waive informed consent, which is of course a problem, a risk of having higher numbers of over-medicalization because of the lack of services. It's much easier to do a prescription online and then just increase the number of medicine instead of providing for the services. So we have to be careful about, and also that many people doesn't have access to the services online, etc. Right? So all of these issues are impacting, and on top of everything, we have now this big and important concern of the general population of what it's going to be the impact in levels of anxiety, fear, and the uncertainty that this crisis is creating for the general population, and the mental health responses that are needed, that we need to make sure we'll avoid the pathologization of some of these responses. So the normal emotional responses of people should not be pathologized, so that we can increase, it might result in an increase in the way in which we treat or perceive persons with psychosocial disabilities, right? For me, the crisis, which has been a wake-up call, and a very sad wake-up call for the disability community, it's also giving us an opportunity. It's an opportunity to rethink how we can recover better, how we can think about building back better and learn from these mistakes. The disability community has been stressing for many, many years and decades many of these issues, but I think that now evidence is clear in helping us to advance. So we need to make sure that we are going to build more sustainable, but most of all, human rights-based mental health services, right? We really need to look back at the Convention on the Rights of Persons with Disabilities, its standards, and develop national policies and legislations that are online with the Convention, that are combating discriminatory practices, that are based on the participation and consultation with persons with disabilities, that combat stigma and misperceptions about persons with disabilities, that contest the charity and the medical model of disabilities, and understand that we have to think beyond and with a change of paradigm that the Convention is calling us to do. And of course, that we need to have a change in the way in which we provide services, and services that are community-based and are recovery-oriented. So for that, I want to just highlight briefly 3 main topics that I believe need to be considered when building back better. And those are issues that I have highlighted in my reports, as was mentioned before, that I have produced these reports. But of course, I want to run very briefly through 3 main topics, which are: we need to think about the full recognition of legal capacity and the provision of supported decision-making, is the first point. The second point is that we need to invest and to think and to change the policies to reduce and eliminate the use of coercion. So we need services that are free of coercion. And the third point is that we need to invest in support and community-based support and services. This goes beyond, this is a whole change in the approach in which we are doing things. So the first point, I worked in a report on that, but basically, and many of this is also has also been developed through the quality rights models of WHO, which I think are a very important tool. And I'm very glad to know that this is getting traction and that states are engaging and implementing and following the guidance of these models. So we really need to consider, when talking about legal capacity and provision of supported decision-making, that we need to think about ways and consider options like advanced planning, how people can access the correct information, not biased information, to provide their informed consent. What is the types of support that can be provided to make decisions, the supported decision-making that we mean, including informal ways of providing this supported decision-making, including by family members or friends or peers. And this is part of the quality rights model. Also, we need to engage in legal reform. We need to change our legal frameworks and understand that we need the recognition, the universal recognition of legal capacity for persons with disabilities. And many countries around the world are advancing on that. In Latin America and around, we're seeing a positive trend towards that. And then also I want to problematize is that if we're changing this paradigm and we are rethinking the responses under a human rights-based approach, perhaps we need to ask ourselves, why is that we need mental health legislation? And if mental health legislation is helping us to actually achieve the convention, or to justify and create exceptions to implement the standards of the convention. And this is something that we need to problematize to move forward and perhaps realize that this legislation might not be of use anymore. The freedom of coercion, I think it's important because we need to invest more and more in the alternatives. We have also produced a report together with the University of Melbourne on analyzing what are the alternatives to coercion and how do they work and how effective they are. And I think it's very interesting that the report is telling us that they're quite successful and that states are not combining all the different forms to provide these alternatives. And if they would try, it might be quite interesting to see how the whole package works. We need to invest more in implementing these alternatives and then eliminating the use of coercion at all levels. There are examples, and of course in this crisis, it's clear that no one shall be forced to remain in a hospital against their will if they're at an increased risk of getting infected of the COVID. And again, this reinforces the idea of why we need to avoid the coercion. And then the last point, and with that I would like to finish, is so how do we promote the structural change and with a community-based approach, right? Moving away from institutionalization, moving away from coercion. So how do we understand that this is not something just an add-on in a specific service or a pilot service that could help? No, we need to redefine the approach in which we are delivering the services, understanding that psychosocial disability or that any other condition, intellectual disability, should not be seen as a diagnosis or as a biomedical issue, but we really need to go beyond that and use the convention to understand that there are many other factors, the social determinants of health, and how the interaction with these barriers and with these conditions is actually the one that all these factors need to be addressed instead of focusing only on addressing a condition or an impairment or a perceived impairment. We need to remember the participation. We need to remember that we need to focus on people. So everything needs to be people-centered, recovery-oriented. We need to have integrated delivery services, and this is important because we need to make sure that while addressing the social determinants and the structural barriers that persons with disabilities face, we also discuss about housing, we discuss about poverty, we discuss about the support that is needed, we discuss about the importance of having community-based services for other areas that complement the mental health services, that there might be a need to have supported employment, personal assistance, and etc. And of course, and I finish with that, nothing can be done without having in mind the need of consulting, engaging meaningfully and actively with persons with disabilities and their representative organizations. They are experts, they do know what they need, and it is important that all the reforms and all the changes take into consideration what are their needs. I thank you again for this opportunity, and I look forward for the discussion.
Thank you so much, Catalina, and Devan, for emphasizing the fact that there's nothing about us without us, that we must actually engage all those persons with psychosocial, intellectual, and cognitive disabilities in our discussion. And now we'd like to move to the next panelist. And for those who have just joined, we just want to remind you that in case you're using social media or tweeting, you can use the hashtag #QualityRights and COVID. And now for our second panelist, her name is Felicia Mburu. She holds a Bachelor of Laws from Moi University, Kenya, and a Master's in International Legal Studies, specializing in human rights law from American University, Washington College of Law, USA. Felicia is interested in using law to pursue gender justice and the intersection with the rights of persons with disability to legal capacity and live in the community on an equal basis with others. Felicia currently works with Validity Foundation, which was formerly known as a Mental Disability Advocacy Center, and she's the Africa Litigation Manager. Welcome, Felicia.
Thank you, Joy, for the introduction, and thank you, Catalina, so much for getting the background. Because what you said is basically my presentation in summary, but from a global perspective. So I'll start with who we are as Validity Foundation, because that is what informs this presentation. We are an international organization that works, we use legal strategies to promote and protect and defend the human rights of persons with mental disabilities worldwide. Now, in using these legal strategies, especially in this pandemic, we come to see a lot of issues coming up. Like Catalina pointed out, this pandemic caught us all flat-footed. And essentially some of the issues, not very clear. Can you hear me now? Much better. So some of the issues that we are coming across during this pandemic essentially have all arisen out of the lack of implementation of community-based services. We'll get into the details of those later, but right now I just want to give you a context of what it means to use legal strategies to fight for this. We use the Convention of the Rights of Persons with Disabilities to fight for the rights of persons with psychosocial disabilities. And in that regard, you get to find that there are systematic and structural issues that end up leading to human rights violations. And some of these include the lack of legal capacity, the denial of liberty that has been entrenched in our various laws, practice, and systems, the lack of access to information, and all of this, in addition to COVID-19, has just made the situation worse for people with psychosocial disabilities. And then there's the general stigma and discrimination associated with psychosocial disabilities. So I'd like to just put us into a context of what is a psychosocial disability, because there's a lot of misunderstanding and misinformation about psychosocial disability. Psychosocial disability is the interaction between impairments and the social, cultural, and environmental barriers that come around it. So this webinar is so timely because you realize a lot of countries that we work in, because Validity Foundation both works in Europe and in Africa, in several countries, but you always find the situation is the same. When it comes to psychosocial disabilities, everyone tends to focus on the impairments, which is now the medical model of things. But when you focus on the medical model, you forget about the social impediments that actually determine the well-being of the person. These social impediments can be issues like access to work, access to family, access to community services and such things, and how those barriers are the ones which end up causing the disability. So the social model of disability is what we work around with, and I'm so glad that QualityRights also has adopted that model, because that is where the problem is. Now, coming into the context of this pandemic, because again, it brings another clear misunderstanding, because everyone is thinking public health and how to protect the general public. But the issues of psychosocial disability are usually magnified in any pandemic. It's not just this situation because of COVID-19, but all emergencies will always have something in common. It might lead to separation of families. It might lead to being cut off from services. It might lead to physical and psychological distress. There are specific human health and nutritional needs that persons with psychosocial disabilities have. And then there's a risk of abuse and violations. Well, when you create all this, whether it's floods that are causing the emergency or it's a pandemic that is causing the emergency, you always end up with a worse scenario on the rights of persons with psychosocial disabilities. So how has this pandemic impacted persons with psychosocial disabilities. So currently, Validity and partners, we have been doing global monitoring just on this particular topic, the pandemic and the impact on persons with psychosocial disabilities across the world. And we're getting feedback from as far as Latin America, Europe, Asia, and all of that. And a common thread keeps coming out, whether it's Africa, whether it's Europe, whether it's America, the same issues. There's country-specific issues, but there are particular issues that are standing out clearly. There's the issue of isolation and separation, which can be isolation in terms of being separated from family, because one thing with psychosocial disabilities, persons who live with these different conditions need their networks, they need their families, they need that peer-to-peer support to continue surviving. So a lot of people are suffering. We're even getting cases of suicide in Uganda amongst persons with psychosocial disabilities because of being isolated. There's we are seeing laws coming up which are saying that the first thing that most governments did was close down institutions. I know in Africa, we don't have the institutional setting per se, but we do have isolation. So you find institutions where persons with disabilities are automatically shut down, their families are being excluded from visiting them, and that is leading to a lot of, it's making their conditions worse. We're also seeing violence within the family and the community. At this point, I have received so many cases on sexual and gender-based violence against women and girls with mental disabilities. It is ridiculous the amount of violence that they're facing, not just from their families, but also from the community. I will not stress on the issue of police brutality, especially for those people with psychosocial disabilities who live on the streets and they don't have an alternative, because we have realized psychosocial disability and homelessness and also in the criminal justice system tend to go together. So there's a lot of police brutality going on around that. The issues of infections in institutional settings. So whether it's in the classic institutions that we're used to or whether it's in psychiatric facilities, we are seeing cases of COVID-19 erupting in such situations. And remember, there's a moratorium to keep people in the institutions. So then what happens in terms of social distancing? How do we protect people who are not positive? How do we even get the information to them? There's the lack of access to medical care. Medical care here intentionally means anything outside of drugs. Because we realize when you talk about psychosocial disabilities, there are different angles to look at. There's the counseling, there's the therapies, the peer-to-peer support, there's access to drugs, and access to even physical health. How do they, if I, as a person with a psychosocial disabilities, I have to keep seeing my doctor, I have to keep seeing my, going for my sessions and things like that, but there are no procedures and guidelines on how I can access my medical care. There's the legal barriers created by the Public Health Act. These lockdowns and curfews without proper guidelines are really causing a lot of physical barriers and other accesses related to that. Persons with psychosocial disabilities, in most cases, will be linked, there's always a link to poverty with people with psychosocial disabilities. So you find when you create legal barriers, so there's putting in a lockdown without guidelines, putting in a curfew without guidelines, or even just stay-at-home orders generally, and not giving proper guidelines on how people can leave their house to get, whether it's the medical care, whether it's to get the food, whether it's to keep going to employment, because you know you can't stop working when you don't have any food in the house. It's creating a lot of problems. Then there's the financial difficulties and access to food. That complaint is global. We have been receiving it from so many partners. And then there are other issues that arise, such as access to courts. Now this one is a unique one because we didn't quite expect it, but we're finding like people, persons with psychosocial disabilities who had ongoing cases or are currently facing like domestic violence and sexual and gender-based violence, and they need immediate access to court, you know, protection orders to keep them out of a domestic violence situation, or to protect their property now that they're being kicked out to their family land and things like that. How there's no guideline on how to protect them. And when you go to courts, the courts, they won't, we're finding a lot of barriers from the systems because they say psychosocial disability is not an emergency at this point. And in fact, mental health is not being classified as an essential service as well. So there are so many barriers that you don't even know where to start. But all this points to one thing, the lack of community-based supports. Because all these services involve the community. Employment is about community. Food is about community. Medical care is about the local clinic right next to you. If community-based services were being provided, then we wouldn't be seeing some of these violations that we're seeing against persons with mental disabilities. And for instance, we have now practically from a human rights-based approach, as Catalina pointed out, we do need to put the person in the center of it all. Because when you sit down, every day I sit down with people with psychosocial disabilities facing issues in different categories, but it all comes down to one thing: legal capacity, liberty, and access to information. The information being given about COVID-19, I do realize the pandemic caught everyone flat-footed. We don't have much information, but even the little information that we have is not being disseminated in a simple language, accessible language that persons with with psychosocial disabilities can access, including those in institutions. Institutions are just shut down. There was no information that was shared. Those living in the community, again, there's literally no information going out, and if it does go out, it is too technical to be understood. So this lack of information, and even people being rounded up from the streets, they don't understand why we're being rounded up. If you're caught outside after curfew hours, you're in trouble. No one is explaining anything, and even where it's being explained, it's not in a language that people understand. Liberty, recently Validity Foundation with some partners in France, we had to file a case about discrimination in how the policies were being implemented. We realized that some of the guidelines that were being given were very discriminatory against persons with disabilities in institutional settings. So you can start, even if the public health guidelines have to be issued, we understand that concept, but they have to be on an equal basis with others. So where some guidelines are more discriminatory against persons with disabilities, that has to be pointed out, and people have to be held to a higher standard of account. There's the issue of legal capacity. Assuming I have a psychosocial disability and I end up contracting COVID-19, how are my rights going to be protected? How am I going to be explained to about how to protect myself, give consent for treatment or not, being taken to quarantine and things like that? So you realize legal capacity, it's being flaunted all over the place. And consent is not being sought, and people are just, it's up to you to decide. Caregivers now have turned to a level, because most institutions are shut down, they're not taking in any new admissions, which somehow is debatable. But at the same time, you realize these families are left with no option and no information. So what they do is they grab a huge caseload of drugs and go and lock their family member in a separate room, basically isolating them, which leads to seclusion, restraints, and other human rights violations. So while we are talking about respecting legal capacity in our legal frameworks and our policies, this also has to go down right to the community to ensure that the community understands legal capacity and respects the rights of persons with psychosocial disability to exercise their own legal capacity. Then there's the idea of mental health not being classified as an essential service. While I do realize right now the main purpose is to focus on the public health question, these are pre-existing conditions or conditions which will end up developing because of the situation we're going on, that is going on right now. So there has to be a plan and an accountability mechanism to ensure that mental health is provided during the pandemic and even after the pandemic, because these cases will get worse. Persons with pre-existing conditions subjected to these sorts of violations, their conditions will get worse. The general public itself, subjected to isolation and whatever other consequences that come with isolation, will at some point also develop mental health conditions. Health workers, frontline workers, the things they're seeing right now, we are also seeing them developing some form of mental health conditions. So mental health has to be prioritized for everyone, not just persons with psychosocial disabilities, but it's not being prioritized, and it has to be prioritized in a manner that is accessible to the person in the community. For instance, right now we're being told, don't go to hospital, it's too risky. Yet I have a psychosocial disability. I have to get some form of care. I have to go and get my medication. I have to go and get my counseling services. And all of these are provided in the hospital setting. So I can't go to hospital, but I still can't get my services. What does that mean? There has to be an alternative, and the perfect alternative is community-based services, because this looks at my social, my economic, and my cultural needs that go with that. And then there's the question of resources. How do we get this done? Again, it comes back to there are already models out there that are being adopted. The Special Rapporteur's Office gives some interesting guidelines on how to provide for the rights of persons with disabilities during a pandemic. We have the WHO toolkit on community-based services, which ironically, if they had been implemented, would actually be protecting persons with psychosocial disabilities right now, because it gives procedures on how to provide community-based services from a human rights-based perspective. We have the issue of monitoring and accountability. This is now where the national human rights institutions come in. While we are seeing violations, human rights institutions have the right to actually, most of them, not all of them, most of them have a mandate to monitor situations and document them and make even recommendations in some instances on how to improve on the human rights approaches. So there has to be, for human rights approaches to work in this pandemic, there has to be close coordination with the national human rights organizations, but most importantly, human rights approaches advocate for centering the person as a resource in fighting, in ensuring human rights are upheld and also in fighting this pandemic. So how do we center the person? Involve people with lived experiences and their caregivers and their communities in finding solutions to providing community-based services during this pandemic and even after. We have to have an aftercare program after this crisis is over. And there are multisectoral approaches. We're talking about social and health implications of COVID-19 on persons with psychosocial disabilities. People will say there are no resources, but there are resources in other line agencies. We're talking about social agencies, the ones which are tasked with providing social services in the community in whichever relevant country. So each country has a type of social safety net. So how are we ensuring that these social agencies are involved in helping persons with psychosocial disabilities in through maybe direct service provision, issues of food and water and sanitizers? How are we ensuring that these social services reach the people with psychosocial disabilities in their different settings? How are we ensuring that the social agencies are also providing access to let's say employment, access to protection, social protection for victims of gender-based violence who are also living with various psychosocial disabilities? So this requires a multi-sectoral approach, and we cannot limit it to just one line agency. It has to be wide. But at the end of the day, what is coming out clearly from all the monitoring that we are doing through our through our initiative, the Global Monitoring on Disability Rights, and also from people that we work with directly in the different countries where we are located, is that the issue of psychosocial disability and COVID-19 would have been best addressed in the community setting. If you want people to stay at home, then you have to provide services for them at home. Thank you.
Thank you so much, Felicia. And clearly, we have all discovered that this crisis is a wake-up call for us to be able to rethink and offer a human rights-based care, and we need to focus on the psychosocial disabilities, and we also need to have a person-centered approach. And I believe this is what both panelists have emphasized. And now we have quite a number of questions. And to start us off, there's a question to Catalina. How do we address new clients coming down with psychosocial disabilities in the midst of COVID-19?
Sorry, how do you address the needs?
Yes, new clients coming down with psychosocial disabilities in the midst of COVID-19.
Clients. Well, I mean, I was actually reading because the chat is quite active, and there is a very interesting conversation. I'm sorry, I was following that. But it is important, I think, to go back a little bit and refer to Felicia was doing a good recollection of some of the efforts that the international system is putting to support governments and addressing the challenges and needs of persons with disabilities. So there is indeed the considerations on the disability inclusive response by WHO. There is recently released also the guidance of the Office of the High Commissioner for Human Rights and the Secretary General policy brief on persons with disabilities and COVID as well. I think those three, I have circulated, I have contributed substantially to those three elements. And indeed, we have to go back to the basics, right? I mean, people with disabilities is not being protected, right? And when we go to institutions, there are no protocols, there are no basic measures of hygiene or protection or mask. We're seeing cases in which, for instance, persons with disabilities the staff is protected and persons with disabilities are not protected. It increases, it's kind of leaving persons with disabilities neglected, and also this whole notion that their lives, our lives, are less valuable than the rest of the lives, right? We have to safeguard the lives of those that are working in the institutions or that are providing the services, but not of persons with disabilities. We have, and I'm reading, there might be an increase in the numbers of involuntary admissions in the hospitals. And first of all, before I said that, I just want to say something else, is that we're not gonna stop a pandemic unless we address all the challenges of the hotspots, right? Even if it's an opportunistic line, I do think that the general community has to understand that having hotspots, it's not going to help us to contain the pandemic. And yes, addressing the needs and challenges of persons with disabilities in all, and whether at home or in an institution or a psychiatric facility, will help us to contain the infection. It will help, of course, to reduce the number of fatalities of persons with disabilities. And it will, once and if these responses are designed under a human rights-based approach. I think that I mixed a lot of responses that I had in my mind because I was reading this, so I'm sorry, and I can clarify later on some of the other points.
Thank you so much, Catalina. Another question to Felicia is, you've mentioned about the community-based approach, and and some of the reports that have come to you of people who are undergoing sexual abuse. So the question is, what plans or measures are there in place to ensure that we have the community engaged?
Wow. Well, while you are reading that question, another complaint on sexual abuse just came in through my phone. So that's how prevalent it is. Now, I can't give a direct answer to that question because it's largely dependent on the country-specific situation. But overall, the systems that were already in place have to continue. That's the one thing. Everyone just ignored the already pre-existing systems and gave priority to public health. Yet these systems serve a very key purpose. So in the context of gender-based violence and sexual violence, you find that already there were organizations that used to provide free legal aid. They used to provide safe houses for victims of violence and things like that. There was police investigation ongoing. Once you report a case, there were procedures around how to continue the case. The person gets arrested, etc., etc. Those systems cannot stop functioning in a pandemic. Now that's why it becomes country specific. So the recommendation here is whatever existing systems that used to happen to protect victims or survivors or potential at-risk persons who are at risk of violence should continue and should be prioritized. Now, it's up to the relevant, depending on the country, if it was organizations or the relevant line agencies to actually advocate for that to continue in line with the CRPD. So That would be my long and short answer to that. Like I said, there's no direct answer to that. In terms of direct needs, again, it comes down to the multi-sectoral approach. There are systems that exist to provide social services. So we just need to link those systems to persons with psychosocial disabilities, whether it was through civil society or through a government agency or through a social system, depending again on your country. This has to continue. So it's about advocacy and make sure that so it's advocacy and holding governments to a higher standard of accountability.
Thank you so much. We have many amazing questions. One other question we can look at is there any specific good practice around the world we could get some inspiration from, and of what is currently working, providing quality information, response, service to people with psychosocial disability in the pandemic context? So, Catalina.
Yeah, thank you. Well, there's always the question, right? I mean, where are the good practices and how we can look at it? I think that the document that I mentioned of the Office of the High Commissioner, and I'm going to ask if Alberto, who is listening, could share the link of that. They have gathered examples. I will say that no country is doing everything right, but some countries have started to address, given the feedback and given the challenges that they face, some of the difficulties, for instance, with the isolation measures and with the lockdown measures, right? And the impact that it has on persons with psychosocial disabilities, and how to be more flexible with some groups of persons with disabilities so that they could go out or that they could receive the services that they need. The disruption of support services in general has been a big challenge. And so states are starting to acknowledge that. Measures to, for instance, release persons that were in hospital and when possible, they didn't need to stay in hospital. And this includes, of course, psychiatric facilities. So states are making efforts in that direction. I wouldn't say that there's one country that's doing it all, but they have been, and I think that the different documents that I've mentioned have been helping to highlight where the challenges are and where the intervention needs to happen. It has been mentioned a lot of social protection. That's another area in which I believe it's important to put more and more attention, because persons with disabilities are affected now, of course, and will be affected by the socioeconomic crisis afterwards. So what are the measures in place to protect persons with disabilities with income support, or whether through the different benefits that might be available, and even creating new benefits, or making flexible adjustments so that people that was not eligible before for these benefits could benefit in the aftermath of this pandemic. So if we can share that information with you, it's important for states to be vigilant, and also because this is going to be apparently a recurring issue where the waves of the pandemic come. So we need to be vigilant both of, and Alberto has just shared the guidelines on COVID of the Office of the High Commissioner, but it's important that, so we think about how, on the one hand, of course, we address the urgent demands and stop the fatalities and the risk of people with disabilities to get infected or to be disproportionately affected by the emergency measures. But also we need to start thinking of, indeed, I saw one of the comments, how do we move for good with a process of deinstitutionalization, a process that means that we are not going to segregate and exclude and discriminate persons with disabilities, but to provide them with the support that they need to live in the community in an independent way. And to do that, to close these places, we really need to have an important change in the policy. And this is something that the disability community has been requested already for many years, decades.
Could I just add a bit to that? So, for instance, we both agree that the issue is putting the person right at the center. So we've seen some person-centered approaches that are actually working. For instance, in Zimbabwe, there was the issue of access to information on COVID-19 for persons with disabilities. So the disabled people's organizations sued the national TV for lack of, they weren't providing accessible information, and it's an ongoing case right now. And basically, the minute the case was filed, the corporation changed how it was presenting its news. That's already a good practice, holding people to a higher accountability. I've mentioned the French case, which we used. The outcome was to challenge policy that was put in that was specifically discriminatory against persons with psychosocial disability, persons with disabilities living in institutions, and immediately the minister, I think it's a minister, sorry, my French is terrible. So the minister immediately just changed the policy to ensure that it was equal, it was cross-cutting to all persons. Person-centered approaches, we're also seeing institutions now, there's generally a moratorium. We have been calling for a long time for a moratorium on new admissions, because especially involuntary admissions should not be allowed. But we're seeing situations where now families are actually stepping up, the organizations which do provide community-based services in Kenya and are still providing even in this pandemic. So thanks to institutions actually closing down and saying that they will not provide any inpatient care, these families have now turned towards the community services being provided by these organizations. So those are some of the best practices that maybe we could we could recommend to be scaled up to a higher level. But again, remember, they're very specific, they're regional specific. So it's about getting the information out there that there are alternatives.
Yeah. And so we're really having, there's a great conversation going on in the chat, and still a couple of questions. But in the interest of time, I'd like to ask each of the panelists to say a closing remark. You can start with Catalina.
Well, I was ready to continue. I think that this is quite an engaging conversation, and that means that indeed there is a great need to engage in this discussion and to develop and to deliver responses that are more adequate to address the needs and to address the rights of persons with disabilities. I think that if we reflect on what has happened, it's basically that although globally we have made an important and significant progress on implementing the Convention on the Rights of Persons with Disabilities, and there is more and more awareness and capacity, I will say, on these issues, we still need to have more policy development that is online with the Convention on the Rights of Persons with Disabilities to make sure that at the end of the line, the responses will be inclusive. And so what we're seeing is that we're still in the middle of that process in which we have been clearly and very rapidly identify the challenges, but we don't have the means to respond to those challenges in a human rights-based approach, which is the only response that is feasible and will be sustainable and adequate to address these challenges. So how do we move to the implementation of the convention, and how do we address the most ingrained systematic practices that are violating the rights of persons with disabilities? And more than that, I think that many of the comments agree. These last 3 months have been of immense anxiety and stress, and also they have been overwhelmed for the community of persons with disabilities. We have that feeling that we are completely alone, that we have been left behind, that everything, the whole system was disrupted, and some of us that needed the support the most were not able to get that support anymore because the support networks are informal, because our system of managing life hasn't been somehow integrated in the policy making of the nations, and we need to change that. We definitely need to address those, and to make sure that while addressing those, we are using this opportunity to enhance and not to limit the rights of persons with disabilities. And that's the risk of not looking at it through a human rights-based approach, that we might end up with policy responses that will further affect persons with disabilities. So we don't want to see at the end of the day that what we will have is better institutions or cleaner institutions, or people moving to different smaller institutions. We don't want the phenomenon of trans-institutionalization. We want a complete close of those institutions and a new and more innovative response to, for instance, that problem, right? So I am very happy to see that there is such an important engagement. All the questions were very relevant, and my mandate remains, of course, available for any further engagement and to support the efforts that are taking place in Kenya, and hopefully to take further the implementation of the quality rights, which I believe is a very important tool to get us closer to the convention. Thank you.
Thank you so much, Catalina and Felicia.
Wow. Sorry, I was just reading through the questions and there are so many. Basically, it comes down to the issue of accountability, whether it's prisons, whether it's institutions, whether it's hospitals. There are several things. It all comes down to holding these institutions, however you choose to define them, to a higher accountability standard. And I'm not saying make it better, but rather close them down. That's the only way we can protect persons with psychosocial disabilities, is to ensure that institutionalization is a thing of the past and providing alternatives in community-based services. So the Quality Rights Toolkit, the Quality Rights Training comes in very handy with this. There are so many organizations which are doing the same thing, a similar thing, not the same, providing community services. I cannot overstress that point. That also applies to prisons as well. For instance, I know currently in Kenya, we are going with Kenya, Malawi as well. Oh, who else started it? The Kenya and Malawi essentially have been doing the release of petty offenders, and you'll find a lot of petty offenders tend to be persons with psychosocial disabilities. So while we're doing these programs, we have to ensure that all our legal policies, guidelines, and anything else around that involves persons with disabilities right at the center. So you center the person. And in terms of at an organizational level, it's about also getting organizations to work together, to network, and Validity can actually provide support around that on how to ensure networks, disabled people's organizations are holding governments to a higher standard. I think that answers the question by Quality Rights Kenya as well. So yeah, so my conclusion would be center the person. For human rights approaches to work, we have to work with persons with psychosocial disabilities themselves, their networks, and their caregivers to ensure that their rights are not violated, and whatever sustainable, because again, this thing is long-term, it's not going to end in another 6 months. It might reoccur in another 2 years, we don't know. We have to ensure sustainable mechanisms, and the only way we can do that is by ensuring human rights standards are ingrained in whatever systems, policies, and laws that we come up with, and by centering them around the person with psychosocial disabilities.
So thank you very much to both our panelists for this very informative discussion that we've had. And for those who'd like to know more about the WHO Quality Rights, I have just sent a link on how you can log on to the e-training, which will give you all this information and more. And it could be a good foundation, even as to start and progress in order for us to continue this great discussion. And we'd also like to welcome you to our next webinar, which will be the next Wednesday at the same time. And as we'll just be discussing all about the WHO Quality Rights and how we can implement it in this during this pandemic of COVID-19. And so thank you very much for all of you for coming, and we look forward to seeing you in the next webinar session. So thank you so much and goodbye.